All right, looks like everybody is logging on now. So, Ryan, why don't you go ahead and kick us off and we'll get started.
Absolutely. Thank you, everyone, for joining us on this Friday afternoon. I want to make a special welcome out to Dr. Jennifer Hirsch-Cabral, who is joining us and who'll be presenting today. Before we jump into the presentation, I want to mention just a few quick things. Our topic today is getting to know your patients and getting your patients to own their disease, communicating expectations clearly. Very excited for this topic and really believe that Weave is one of the premier value opportunities to communicate with your patients. If you have more questions about Weave itself and its platform, you can see there's a button on the top of your screen that says request a Weave demo, and you do so and we'll get you in touch with a product expert. If you have questions throughout the presentation, please feel free to put them in the Q&A. We will be trying to answer them in the course of the conversation as well as at the end if given time. Feel free to add them in the Q&A and we will try to get to them as soon as possible. And if you have further questions, Dr. Jennifer Cabral will be leaving her contact information near the end, so you can get more in touch with her personally and email her. She's fantastic at communicating and really has so much content that we are condensing this down to about, we're going to try to get this finished at roughly about 3:15 Eastern Standard Time. And if you have additional questions to follow up with her afterwards, we highly encourage it. All right, so I'd like to introduce our speaker, Dr. Jennifer Hirsch-Cabral. She is a board-certified periodontist and owner and CEO of Periodontal and Implant Associates, located in Cullman, Alabama. She serves as a faculty member of the PICOS Institute, chair of the Alabama Dental Association Council on Budget and Auditing, and WISE, Women in Implantology Supporting and Empowering Advisory Board. In 2012, Dr. Cabral was recognized as one of University of Georgia's prestigious 40 under 40. And most recently, Dr. Cabral was selected as the 2021 Most Excellent Fellow of the Alabama Dental Association, one of the top 10 young educators in America in 2012 by the Seattle Study Club, and was inducted as a Fellow of the International College of Dentists, as well as a Fellow of the American College of Dentists. Very long intro. I can keep going with accolades, but I'd love to get straight to the content. Dr. Cabral, how are you doing today?
I am doing great. Thank you and Dallin so much. Thank Weave. I'm so excited. I know we have a limited and finite amount of time, so let's make the most of it. Super duper excited. I know we have a large audience today, and I want every one of you to know this is all about you, and this is all about what we can do for your practices, for your patients, and hopefully something that you can take back to your practice the next day that you go in it. So Ryan, without further ado, you and I spoke about this yesterday. We're going to have fun. We're going to banter back and forth. And please, everybody, use the chat feature. We want questions. You'll have my information. And please use me as a resource. I'm here to help. The information that we're going to talk about today, this can be covered in a 3-hour lecture, a 6-hour lecture, an 8-hour. I give multi-day lectures. If there's anything that I can do for you, for your team, for your community, for your study clubs, whatever it is moving forward, I am here for you. So let's talk about how we can get our patients to OWN, own their disease. I would be remiss to talk with you and be with you today without telling you who I am, why I'm here, how important dentistry is to my life, to my family. I don't know anything else but dentistry. The gentleman that you see on the screen here, yes, I did cheer at the University of Georgia. Ryan, you didn't mention that.
I did not mention that, and I definitely should have. I'm throwing in the chat if we have any other Georgia graduates here today.
Go Dogs, especially this year. If you're a Georgia fan, you are probably just still glowing like I am. But yes, I did cheer at the University of Georgia, but I put this in here because I want to share with you that the man in the picture was my biggest cheerleader. The man in the picture, it was Dr. Harold Z. Hirsch, and he was a practicing periodontist in Alabama for over 30 years and had 2 periodontal locations. My mom is, God willing, thank the Lord, she's healthy, she's with us. She sells dental supplies. She's been in the dental industry for over 40 years. And so, like I said, I don't know anything else but dentistry. We truly are in the best profession on the planet. My father, Dr. Hirsch, passed away suddenly during my first and second year of my 3-year periodontal residency. So immediately I lost my mentor, I lost my cheerleader, I lost my teacher, and most importantly, I lost my father. And I share with you that because I wouldn't be here today if it wasn't for the individuals that lifted me up. I was a sponge. My faculty at the University of Alabama, Birmingham allowed me to do the residency half a day and drive an hour to my 2 practices up to North Alabama and Northwest Alabama to be able to do what I do. And so if it wasn't for my team and the faculty, I wouldn't be with you today. So thank you for allowing me to share my story, my family's legacy, my father's legacy, and everything that we do in our practice, we do it we do it to continue that legacy. There's not a day that goes by, Ryan, that I don't have a patient that comes in that my father didn't have the opportunity to affect and change their lives. So what a huge honor it is for you, for us to be together today, for me to be able to share how we can impact each and every one of our patients' lives. And what I want to tell you is, when my dad passed away suddenly at 53 years old, it made me realize so quickly how important it is to make every moment count. Every moment count, y'all. I've got to throw in some y'alls. I am from Alabama, so you're going to hear a couple of those here or there. But now more than ever, I learned that very quickly when my dad passed away. But now more than ever, we know in this time that we're living in, out of adversity comes opportunity. Out of adversity comes opportunity. We're living in a very, very different time than we were 3-5 years ago, but there's so much opportunity that's come about this. Ryan, you and I had a great conversation about this yesterday. We now are talking on a virtual platform, everybody. We've got Zoom, we've got Google Team. We had the ability, when our lives hit a turn that we never could have imagined, to push the reset button. We now have teledentistry. And most importantly, I love the picture at that bottom right. We had that opportunity to push that reset button, spend time with our families, reevaluate what was really important. And Ryan, I loved, you made some great points about this when we talked yesterday, just about the opportunity to push the reset button and think about even communicating differently, communicating within our own families, communicating with, and most importantly, with what we're discussing today, communicating with our patients.
Absolutely. And obviously, when it hit and the COVID pandemic hit and shutdowns and lockdowns were happening, people had always used technology in their own personal lives. But I wanted to ask, how did that impact in these last 2 years change the way you view technology in your practice?
Yeah, absolutely. I mean, I can tell you, my 11, almost 12-year-old is so much more tech savvy than I am. You know, we laughed about this yesterday, and most of our children are, but we all had to pivot. Our pendulum was swinging very quickly, and we had to figure out how to make it work. When we were doing like we're doing right now, I mean, I'm getting almost, it's just flashbacks of how many webinars I had the good fortune of teaching, but to be able to reach out to people, we were doing it virtually rather than in these live settings. And what we did, I mean, I've got my phone right here. We'll talk a lot about how we've impacted that experience for the two years, but especially the time that we were closed. Y'all, there was so much opportunity to be able to communicate on such a different level. We would text patients just to check in with them. We had so many patients, much like probably you guys, that were home by themselves, and all they were able to do is communicate via phone or via computer. We would email our patients updates, when we're opening, what's going on, how we can help them. We would literally just send out just how are yous. And I can't tell you, when we were able to push that reset button and come back to practice, y'all, the experience of communicating with those patients, it was so powerful. Our patients came back just in tears, hugging us once we could actually hug and say, thank you for reaching out. When I was having a bad day, I was alone, I was isolated. Just by you reaching out, just by communicating, they couldn't even tell in words how much that meant to them, Ryan. So, when you and I speak, so that's just such a powerful message right there.
Absolutely. I mean, it comes down to, it's more than just sending out appointment reminders and that business communication with your patients, but I've talked to so many doctors that during that time period, they were reaching out to patients that they knew were elderly, that they knew didn't have family in the area, and they were asking and talking to them one-on-one and really valuing that social time. And also, even going the extra mile and saying, do you need help with groceries? Do you need help with anything? And then when the patients were able to come and see them again, they really learned the importance of communication just beyond the automated tasks that sometimes we just put into our regular practice and business.
Absolutely. I will tell you, Ryan, we had more patients come to us and say, you are the first dental or medical practice that I am even comfortable setting foot in. And the reason being is because you made me feel so comfortable. You made such a difference during the time that we were isolated. And now, I mean, I know probably all of you on this program are probably busier than you've ever been. And it more than likely it had to do with how you did handle the situation, how you rose to the occasion, how we started thinking differently, and how through adversity we were able to embrace opportunity. So I applaud each and every one of you, because I know you are all doing this. You wouldn't be here with us today if you weren't. And absolutely, I love this. When you can't control what's happening, challenge yourself to control the way that you respond to what's happening. And that absolutely is where your power is. And that's how we make the impact on our patients. That's how we together, I said, we are in the best profession on the planet. I mean it from the bottom of my heart. I am so passionate about this. And it is such an honor to talk with you about this topic today, because I truly believe each and every one of us have the opportunity to save people from dying of dirty teeth. And like I said, the program information that I'm giving, these are hours upon hours of information of how we have the opportunity to save people from dying from dirty teeth. But that's not what we're talking about today. What we're talking about is how we best communicate this message to our patients. So I want you to think for just a moment. And I just want you to just sit back and maybe close your eyes. Nobody's looking at you on the screen, so nobody cares if you're closing your eyes or scratching your head or whatever it is. I just want you to think about, who are you? Truly, who are you? Are you a mom? Are you a dad? Or are you a dentist? Who are you? How do you identify with who you are and what you do? And why are you here? Why are you here today on our program with us for the next 30 minutes, hour? Why do you walk through your threshold at your office when you go back to work on Monday or Saturday or whatever day it is? Why are you a mother? Why are you a father? Why are you here? And what I want to share with you, and this is one of the most impactful lessons, one of the most impactful messages that I can share with you, because it's what it's done to our lives, my practice lives, my patients' lives, is if you haven't listened, if you're not familiar with Simon Sinek, please write this down, take a picture. You can take a picture of any of these slides as you want. I want you to go on YouTube. I want you to type in Simon Sinek. I want you to watch The Golden Circle. And I want you to type in Start with the Why if that doesn't come up. Because what I can tell you is, when you learn about starting with something besides your what or you how, so don't start by telling your patients what or how you do what you do. When you start by telling your patients why you are here for them, why it is important for you to help them change their lives, change their habits, it is going to lead to a connection with your patients, a trust that you never can imagine. So it's Simon Sinek, The Golden Circle. It's about a 12-minute talk about this. There's a podcast to multiple podcasts that he has. Start with your why. He even has a book. I share with you that having a powerful enough why will absolutely provide you with the necessary how. Ryan, we had the best conversation about this yesterday, didn't we?
We did. And especially as patients are getting a little bit more savvy and looking up their own diagnosis before they come in, and maybe they're told something, they come in saying, okay, are you going to do this, or what are my options here? I think it's getting, the important part is communicating why that is the most important part of the next, or why that's an important step in the procedure.
Absolutely. I love this. I mean, how true is this, Ryan? How many of our patients come in and they're, Dr. Google, they're Dr. PubMed, because they've looked up what they expect that you're going to do for them or you're going to say, a lot of times just to quiz us, right? They think that if we don't know something game. So I think this is hilarious. Feel free to take a picture of this. I love showing these type of slides up because everybody takes their camera out and does this. But our patients absolutely, they want to know that we are able to communicate not only what they're reading, but what we can provide, why we're providing this for them. So, all right, Ryan, I tested you yesterday, so I don't know if we're going to be able to get these in the chats, but I want everybody to think about this. What are the top 3, Ryan? You can't say it because you already know. It'd be a
Mouth closed.
I gave you a sneak peek. What are the top 3 things that our patients, and this is universal, this is even global, the top 3 things that all of our patients are most concerned with? I'm going to give you about a second to think about this. And again, this is a universal thought. And we're going to tie this all together about how this has to do with our why as well. So the top 3 things our patients are most concerned about are time, pain, and I'm going to stop here, y'all, because every single movie that portrays, or every single commercial even that portrays dentists or dental team members, hygienists, assistants, business team, they always portray us in this horrific manner, right? So no wonder everybody equates us with pain. I mean, I love these pictures because pretty much all of them, besides the lower right, is what our patients see the majority of the time before they walk in. And money. So time, pain, money. And the thing about that is oftentimes our patients equate time to money. So why do I go over this with you? Our why, we call it our new patient experience, okay? So Ryan, if you walked, or Dallin, if you walked and came to our office for our new patient experience, it starts, your new patient experience starts not actually when your patient walks into the door and through your threshold. It actually talks, it is the first time, that first communication when your patients are talking to your team members on the phone, when they are even on the intake process. So that's why your practice motto, your brand, your culture, the pulse of your practice, you all have to be on the same page. So our why, and this is profused throughout our entire practice, our team knows this, they could repeat this ad nauseum, is we want to get you healthy, Ryan, in the shortest amount of time possible. Ryan's in my chair. I'm going to introduce myself. I'm going to have what's called 5 minutes of phatic conversation, so we get to know our patients and who they are and where they're from, and start to build that rapport. And then I'm going to tell you, Ryan, if you're my patient, or Miss Smith, we want to get you healthy in the shortest amount of time possible. And that is our why. And that right there sets the tone. Ryan, do you want to say anything about this? We had a great conversation about this yesterday.
Absolutely. I mean, when you think of different professions, when I go to my auto mechanic, I'm not questioning his judgment very much because I know very little about cars, but it seems like, and we've seen that across many other professions, but for some reason, the medical industry, patients are becoming a little bit more savvy about their health, and they know just enough to be dangerous. And so a lot of times they come in and they want to either self-diagnose, or they have questions about whether or not that is really needed. And so being able to communicate and let them know, okay, my priority as your physician is to get you healthy, not just to make your teeth better. It's not just aesthetics. Teeth aren't just there for aesthetic purposes. It ultimately is tied to your oral health. And so therefore, I'm your physician, and I'm trying to get you as healthy as you can be in the shortest amount of time possible.
Right. I love it. And I love the fact that you were also able to just kind of say back to what I said, because that means it's stuck, right? So what happens is this: way too often our patients' expectations, and I know a lot of y'all are thinking about this is where we're going, is absolutely true. Our patients' expectations don't meet the reality of what we will potentially be able to achieve. And why is that? And please, 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 please feel free, as I said, to take pictures, take notes, because I guarantee you each and every one of us do what we're about to talk about, because I was absolutely, completely guilty of this. Why our patients' expectations don't often meet the reality of what we can potentially accomplish for them is because we way too often, as clinicians, we way too often, as the doctor, as the hygienist, as the business team member, as the dental assistant, we too often minimize our patient's disease. And the way that we're minimizing their disease is this: we're using verbiage that minimizes. If we tell somebody, Ryan, they have a very little bleeding, they have a little cavity, I think you have a problem. What we see, what we're doing again, is minimizing the fact that they are not healthy. we are causing our patients to not OWN, own their disease, because we're using verbiage that's telling them that it's really not as bad as what we're trying to portray to them. And so therefore, if you're telling a patient, Miss Jones, you have a little bleeding around tooth number 3. You have a cavity, a small cavity on tooth number 15. When we do that, if you tell a patient that they have a little of something or a small amount of something, they're not going to buy into what you're saying. I don't mean buy the treatment. They're not going to listen. They're going to tune you out. How many of our patients come in, y'all, and they have a laundry list? I mean, it might as well be a Christmas list for Santa Claus of medications and ailments, and they still think they're healthy. We have got to do all that we can within our power to be able to explain to a patient why they're not healthy and how we can help them get healthy. Because if not, they're not going to accept the treatment. And I can tell you, if they're not accepting the treatment, there's no way that you're able to get your patients healthy. There's no better example that I can give you. And even now, I have presented this young man all across the globe at this point. There's no better way that I can share this story for you than share with you about Calvin. Now, I know if we have any hygienists on this program, you guys are salivating at the mouth. You want to get this gentleman in your chair tomorrow. Every hygienist on this call, if you are here, is probably going crazy over this. Can you imagine how much excitement there was in my practice when we saw Calvin? Because we knew we were going to be able to do something for Calvin if he understood. If we helped him to own his disease, we were able to teach him about his disease, and then we were able to help him maintain his disease. If we were having a live discussion where I could get you guys to actually answer this and hear your thoughts, hopefully you're putting them in the chats. I'm going to ask you a question. And you can just think about this even. How old do you think Calvin is? I gave you a little hint because I said young man. But you know what? I feel like I'm young, and I'm a lot older than probably many of you on this call. But how old do you think Calvin is? And this plays a very big part into the explanation about Calvin. I'm going to give you one more second. Calvin is a 25-year-old young man that has never had the opportunity ever in his lifetime to go to the dentist. Calvin didn't even know that this was not okay. Calvin didn't even know that he had a problem. And the reason that is when Calvin came in, his mom kind of had his arm around him, and you guys know these patients, she was petting him and wouldn't let him out of her sight and wouldn't let him off her arm. Calvin came in, he wouldn't speak for himself. And when we went over his health history, his mother informed us that Calvin has selective mutism. Now, in college at the University of Georgia, I was a psychology major. I had not heard ever of selective mutism until this mother of Calvin informed us of what this is. And in Calvin's case, whether he has a diagnosis of a selective mutism or not, I will never know. But what happened was his mother was the type of individual that wouldn't let him answer a question. You would ask it, she'd answer. You'd say something, she'd answer. And so she sheltered him so much, she did not even let him know that there was a problem and it could be fixed. But what I want to share with you, by helping this young man own his disease, inform him about a problem, and teach him of how to be able to take care of it, we were able to take Calvin in one appointment. This was just a gross debridement in order to be able to get our probe in order to be able to discuss his disease with him. In one appointment, we were able to take Calvin from a very unhealthy state to an incredibly healthy and comfortable moment in his life. And what I want to share with you, if that doesn't impact you, I can tell you it certainly impacts me and impacted our practice, that we truly are in the best profession on the planet. And if you can get your patients to own their disease, understand what's not healthy so they can understand the goals that we're trying to achieve, by carefully explaining what maybe their expectations are, but what the reality truly is, we have the ability, each and every one of us, to change lives one mouth at a time. We are in the best profession on the planet. We have the ability to save lives one mouth at a time. We believe this so wholeheartedly in our practice that our scrubs say this, changing lives one mouth at a time. Our patients walk in and the carpet says this. You are all so fortunate to be part of this profession. We are all so fortunate to be able to help the patients that we do each and every day. And it's about building a solid foundation for your patients. Because if you don't, and that foundation is broken, or there's holes or cracks in your foundation, we know that disease will persist. Disease, we see each and every one of us disease in all different shapes or sizes. I'm a periodontist, so we see periodontal disease. We also see a lot of rampant caries, but that's the gum and bone support. Yours may be the foundation. Your focus, immediately your eyes aren't drawn to the bacteria and to the calculus. Your eyes may be drawn to the upper right or the bottom right where you see the caries. You may see the inflammation. It comes in all shapes and sizes. These are things that we see in our practice each and every day when we turn the lights on and roll the window shades up. And what happens if this disease goes untreated? And too often it goes untreated because we're not getting our patients to own their disease, because we're minimizing their disease, because we're using that verbiage a little. You have some calculus. You have some bleeding, Miss Jones. So how do we effectively communicate this to our patients? How do you effectively in your practice communicate this to your patients? And maybe after today, you're going to start thinking about things. I can't teach you every tip about communication, but there are tools out there. There are ways that you can communicate differently to effectively communicate to get your patients healthy. And now
Absolutely.
maybe we can just think about it just a bit differently. Yeah, go ahead, Ryan. Absolutely.
Absolutely. And one of the things I love about that is, in the dental industry, we understand the importance of oral health, and we've seen countless research studies talk about the impact of overall health, what oral health has on the overall health. But many of our patients don't know this quite yet, and being able to communicate how efficiently the importance of treatment and how it's going to help their overall health is just something that it's going to grow, and we're going to keep doing it. It starts not only with the dentist, but with the rest of your staff. So I wanted to ask Dr. Brow, when you as the doctor are setting the precedence of how to communicate with your patients, how are you communicating with your staff specifically that they continue in that type of communication?
Okay, first off, I love your question, Ryan, but I'm going to kind of make a statement right there. You used the word staff, didn't you, a couple times, right?
Oh, I did, didn't I?
You did, right? So what I will share with you first, because it's all about empowering your team, right? I am all about empowering my team, because if my team feels empowered, they're going to do what they need to do to continue what our core values are, which is, as I mentioned, getting our patients healthy in the shortest amount of time possible, right? So we use the word team because staff is an STAPH. Staff is an infection. So those of you that prior to coming on this call today, call and refer to your team as a staff, I challenge you, please call them a team, treat them like a team. They will absolutely elevate you when you help to empower them. And if you are all on the same page, I love your question, Ryan, because if we are all on the same page about what our practice core values, our motto, what we stand for is, that is the best way to be able to communicate. Because if you were on our team and you had to step out and somebody else had to come in, you've got to be able to take over exactly where that person left off, right? Because that patient doesn't need to know anything different. The patients that come in, I told you we call it a new patient experience. It starts from the first phone call to when they come in, to when we're treatment planning them, to when they leave, to when they come back to treatment. And it's got to be continuous. And the message that your patients have to get has to have continuity from the start to the finish. So come up with a plan, y'all. What we do in our practice may not work for you. We try to have monthly team meetings, whether it's a 30-minute meeting, whether it's a half a day, so we can continue to work on our goals. And if something doesn't seem to come across properly, for instance, I will tell you, we transitioned from having manual toothbrushes years ago to talking to all of our patients about power toothbrushes, right? Electric toothbrushes. And that came from a discussion of listening to my team, being able to understand the pros and cons of why they recommended it. And what that evolved into is a completely different experience for our patients, right? So does that make sense, Ryan? So it's about all being on the same page, making sure that you're being intentional about the message that you share with your own team. Because if you're intentional about the message, That's going to be how you're going to most effectively communicate with your patients.
Wonderful. And for those team members, obviously being the bearer of bad news is something that not everyone likes to be, especially if someone comes in with poor oral health. How do you help those team members really communicate the importance of treatment, even if they're scared to be, talking about that bad news, that it's going to be more appointments, that they're going to be coming in more and more, and it actually may have more of a price tag attached to it?
Right, exactly. No, I love that question too. And I will tell you, hopefully we have team members and doctors on this program, because I love it. My team says this to me all the time, Ryan. They're like, we were talking to them. The patient looked at us with starry, glassy eyes, and you walked in, you explained it, and they just give you a totally different response, right? And then I walk out, and then they turn to the team member and they say, now, what did that doctor say? So it's really funny, because there are different messages that occur with different points in time with the interactions with our patients. What I can tell you, if you are a team member, don't be afraid to have those difficult conversations. I know that's so much easier said than done, but what you have to keep in the back of your mind, if you're afraid to have those difficult conversations, or if you minimize the disease because you're afraid you're going to hurt the patient's feelings, or you don't want to come across too harsh, if you minimize their disease, they're more than likely, or more less than likely, going to be willing to accept the treatment. And all you've done, unfortunately, is done exactly what we see on the screen here. You've left your patients in a lurch. You've left your patients in a bind, and you put somebody like myself in a position where I'm a surgeon that has to be able to rebuild this to give you a foundation, so you have dentistry to do longer, or implants to do work on longer, right? To do teeth. So us as doctors, team members, if we do minimize our patient's disease and they don't accept treatment, then we've done them a huge disservice. Does that kind of answer your question, Ryan?
Absolutely. And I love talking about that, because ultimately there are as a physician, you're going to sometimes have bad news, but being able to deliver that bad news, and also being able to, it's actually one of the comments in the chat was saying, you don't have to be nice, but you have to be kind.
100%. And there's so many ways. And really, we talked about being intentional. And I think a great thing to do is those team members that are on this program, please, I beg of you, don't be afraid to talk to your doctor. When I speak, I love doing team programs. I love having programs where I have the doctor and the team in the room, because I get the questions all the time. And it's usually when the doctor with the team member, right, for these programs, is it's really hard for me to go to my doctor and ask them what I need to do in this situation. I don't feel comfortable. Well, what I can tell you, if you don't feel comfortable, that may not be the right place for you to be, number one. I have an open door policy with my team, Ryan. Like if they have an issue, if they know my door is closed, it's because I'm talking to a patient or I'm talking to another doctor, right? So for effective communication to start with your patients, it actually doesn't start with your patients. It actually starts with what you do within your own practice, going back to your original question. So I love this. This is a quote on social media for my dear, dear friend, my former professor, who is part of the reason why I'm practicing today, Dr. Mia Geisinger. She's going to be the president of the American Academy of Periodontology in a few years as well. And now she's one of my dearest friends. I love what she put on social media. If we want to change the perception of how dentistry and dental healthcare professionals fit in the promotion of wellness, we need to change our perception and our word choice. It's not just an extraction, it's a tooth amputation. I love that. Ryan, you and I talked about this yesterday as well. We have so many patients that come into us and they're telling us, before we talk to them about taking out and removing a tooth, they're like, Dr. Dubrow, do you understand? This to me, and they're in tears. They're like, this to me is like losing an arm or a leg, right? It's losing a limb. We don't realize how much of an impact sometimes what we are discussing with our patients really has on them. So whoever said that, I spot on. We've got to be honest with them. We've got to be nice about it and say it in a way that they feel like we're being respectful and not disrespectful. But you have to make it make sense to them too. Part of getting your patients to own their disease is helping them understand it. So for instance, a great example I can give you is this. I don't talk to my truck drivers the same way that I don't talk to my hairdressers, the same way that I don't talk to my construction workers, the same way that we're very close to NASA, that I don't talk to my astronautical engineers. What do I mean by that? If I'm talking to my patient who's a truck driver, I'm going to let them know, John, if you are driving your 18-wheeler down the road, down Highway 65, Interstate 65, and your axle is broken, there is no way in the world, John, that you're going to make it on time to where you need to do that drop. So if that axle is broken and you can't drive, what are you going to do? And of course, they're going to say, well, doc, I'm not going to get there on time. I was like, yep, exactly right. So John, it's the same thing. The foundation, the bone, the gum around your teeth, if that foundation isn't solid, there's no way that you're going to keep that tooth on top of it, right? Or same thing with a construction worker. I'm going to talk to Will. I'm going to say, Will, listen. Or Gene, listen. Gene, if you're trying to build that massive, skyscraper, if you don't have a solid foundation in that skyscraper, you're never going to build that 40-story skyscraper. You've got to make it relatable. There are so many different ways to do this. We are in such a different world now. I mean, Ryan, I love what we talked about. Communication is so differently now more than ever. I love this on this screen. What we all do. I mean, our 11, 12-year-old kids even, they've got these phones. This is how people communicate, whether it's right or wrong. This is what's happening each and every day. So if we're going to do it, we've got to embrace it. And I will tell you, and this is not because we're on a Weave event, this has been one of the biggest game changers in my practice to date. We never had anything like this before. I told you about my father. When my dad passed away, we didn't have a website. I think we had one digital sensor. We were still doing film panoramics and PAs. Okay. Y'all remember that, some of you on this call. I know you do. Now, at the touch of a button, and most of it's automated, we're sending people happy birthday messages, get well messages, just a reminder to pre-med. Some people aren't going to love it, and those may be the ones that we still call, but some may want to be emailed rather than text. That's what we're able to do. We are in a different era and a different age of communication. And if you're not embracing where we're at now, you're behind the curve. The pendulum swinging, if you're not up to date with it and you're not familiar how to do it, there's ways to learn. You can reach out to Dallin. You can reach out to Ryan. You can reach out to your local managers to understand how to best communicate with your patients, specifically using Weave. So
one thing I love about this,
absolutely, Ryan.
Sorry to interrupt you. One thing I love about this, the more things change, I'm reminded the more they remain the same. The way that we communicate is changing, and the methods in which people want to communicate is changing, but it still goes back down to the original messages. How are you communicating? What are you saying? And are you doing it honestly and effectively? The tools help you, but you have to evaluate your practice and saying, are we minimizing treatments by using things like a little sore, a little bit of a cavity here, or are we being very upfront, honest, and educating our patients so that they can make informed decisions? Everything that the technology end makes things quicker, but ultimately goes back down to your message, making sure how you communicate with your patients. So I love when doctors are able to pair the two together, that they are very clear in their communication, they're strong, they're forward, and at the same time they can do it effectively, and they can call after treatment, they can send a text following up with a patient. That just helps solidify the methods in which you communicate with the patient.
Well, you kind of took the words out of my mouth, so I could just drop the mic now, right? No, I mean, they're spot on. You listened yesterday when we talked about all this, right?
I do every once in a while. My wife will argue that statement, but it's true.
I love it. Well, no, you hit the nail on the head here. So actually, this is just a little exercise. You can jot this number down, take a picture. If you're not familiar with how Weave works, I love what you said, because it's about being intentional and it's about being consistent, right? So take this number down, call it later. But what it's going to do, if you're not familiar with how something can work so instantaneously, you're going to call this number and you're going to get a message right away. Okay. And this is actually specifically a message you're going to get from our office. This is what it would look like on your phone. Why is this important? As we're closing our time together, I cannot share with you enough. This is why we do what we do each and every day in our practice. If you numb up a patient, which many of us do, both hygienists and doctors, depending on the state you're in, I will tell you what we do in my practice every day that a patient is numb, whether it's with Orachix or with an actual numbing agent. I will call that patient personally, not text them. I will call them personally. I actually use Weave, because as I'm driving down the street, I shouldn't tell you that I'm, using my phone, but it's very easy to do it when I'm doing it from Weave. I will personally call the patients and just check on them. And these are the texts that I get, Ryan, over and over and over again. You did an absolutely fantastic job. I truly appreciate it. And I also really do appreciate you checking in. It is so rare to meet someone so personal and considerate. Y'all, we each have that opportunity. If you're not embracing technology, if you're not embracing where we are now, start. You've got to start. You're selling your practice short. You're selling your team short. You're selling your patients short. And if you are doing it, find out what else is out there that maybe you're not doing. I challenge you to do this. I challenge you to, after our time together, when we get off in just a few minutes, to figure out the holes in your bucket. And that may be the holes in your practice. That may be the holes in life. But figure out where your holes in your bucket are so you can plug those holes. And potentially when you go back to work on Saturday, Sunday, Monday, whenever that is, that you can act differently and do things maybe just a little bit differently for the betterment of your team, but most importantly, for the betterment of your patients. I want to leave with you some take-home messages from the bottom of my heart. Do not minimize disease. Do not minimize your patient's disease. If you do this, they're not going to be owning their disease. And so too often, because we're minimizing disease, our patients' expectations don't meet the reality of what's the case. So please make expectations meet reality for your patients. Know your why. The time will pass anyways. You can either spend it creating the life you want or spend it living the life you don't want. The choice is yours. And as we started with Simon Sinek, we're going to close with Simon Sinek. Working hard for something we don't care about is called stress. Working hard for something we love is called passion. I thank you, Dallin, Ryan, Weave. Thank you for your time. Thank everybody for your time that's on our program today. Here's my personal information. I am here for you. Anything that I can do for you, please let us know. We packed a lot of information in a little bit of time. I want to wish everybody a blessed, wonderful, safe, healthy holiday weekend. And please be well and be great. Thank you for everything. And just have a great and wonderful weekend.
Doctor, thank you so much for this presentation. Absolutely loved it. And it's a conversation which is so relative to today's practice. As patients become more educated, we have to help them in that journey so that they can make informed, educated decisions that are going to benefit their overall health. There's tools to help with that, but ultimately it comes down to what are you going to do as a physician? A quick story before we end. I know you've got a hard stop in a minute, but my dentist used to always refer to himself as a glorified mouth mechanic. And he'd say that jokingly, but at the same time, we need to remember we are physicians, and what we do is going to impact our patients and it's going to make their lives better. And I love that message, being able to make sure that you're helping patients own their disease, and ultimately not so that they are ashamed about it, but they can get better. So thank you so much for your time. If you have additional questions, Dr. Dubreuil left her information there. Feel free to send her some emails. She's very responsive. And if you have questions about how to improve the technology portion of your communication, you can always request the demo up above. I wish we could take Q&A, but we've got that hard stop. So thank you once again for your time, and we hope you all enjoy your wonderful week. Have a great weekend and hope you all enjoy.
Have a great one. Thank you all.